Joining me now is Dr. Thomas Moskal, a Watson Clinic surgical oncologist. And Doctor, when should women start getting their first breast screenings?
In general, your doctor should be examining your breasts on an annual basis. However, as a patient, you should be doing monthly breast self-examinations as well.
Now, what if you have a family history like I do? Should you start getting mammograms earlier, or what's the recommendation?
Well, that needs to be taken seriously because that means you're at higher risk for breast cancer. So most people would start doing all screening guidelines about 10 years sooner.
Thank you so much, Doctor. Dr. Escobar Kaplot is in family medicine at Watson Clinic. I've always wanted to know, oh, you're on the phone. Can you just put them on hold for just a second, Doctor? I've often wondered, when you get a diagnosis like breast cancer, it's very shocking to the individual. When do you go get a second opinion?
Anytime the patient feels like they have questions and they want to know more, or they're not very comfortable with the first opinion, I think it's great to have a second opinion.
And how important is it when you're going to all these different doctors' offices to have family support during a time like this?
It's very important. You know, learning, becoming involved with the process is very important, not only for the patient, but for the family as well.
Joining me now is Dr. Elizabeth DuPont, who is a Watson Clinic breast surgeon. Doctor, what are we've talked about this, some of the common misconceptions that people have about breast cancer?
I think my favorite one is that if you don't have a family history of breast cancer, don't worry about it. Most of my patients don't have a family history, so it should be on everybody's radar. Also, breast pain is an indication of breast cancer. Not true. Breast cancer generally does not hurt. And finally, you're too young to get breast cancer. My youngest patient was 21 when we diagnosed her.
Wow, that's amazing. Another good question is, how does a clinical breast exam differ from a mammogram?
A clinical breast exam is an exam done by a healthcare professional, your family practice doctor, your OB/GYN. It's a hands-on breast exam done in a couple different positions. A mammogram is a radiographic study, and it's an image of your breast.
Thank you, Dr. DuPont. Let's try to get to Susan Bogle here, who's a nurse practitioner at Watson Clinic. Self-exams, you hear us tell you all the time to do them. Why are they so important for women?
Well, the self-breast exam we feel is very important because a large percentage of our patients that find their lump, they find it themselves first before they come in for their appointment. And they're just more in tune with what their body feels like, and they're able to find it, and that helps with early detection.